name's SteveJurch, and I'm the Director of Massage Therapy for the Women's Tennis Association, and I teach continuing education through Jurch Performance Education. And I'm here today at Oakworks, filming some sports massage techniques that I've utilized throughout my career, and hopefully they'll help you in your practice. And one of the things we want to talk about today is ankle sprains and how we can utilize massage therapy to improve the healing. So I have Nate here, and we're working on an Oakworks Boss table, which is their premier sports massage table. And ankle sprains, typically the most common type of ankle sprain is the inversion ankle sprain or the lateral ankle sprain. And in the ankle we have three main ligaments. We have the anterior talofibular, we have the calcaneofibular, and the posterior talofibular. And the most common ligament injured is the anterior talofibular, followed by the calcaneofibular. And these ligaments aren't the strongest ligaments in our body, and which is one of the reasons why they're injured so commonly. When you have a lateral ankle sprain, there's a couple of orthopedic assessments that we can utilize to gather information about our treatment decisions. And we want to be very conscious of how we utilize orthopedic assessments, because we, as massage therapists, we use them to gather information. We use them to help guide our treatment, whether it's appropriate for us to treat a particular condition at a particular time. It also helps us decide whether we want to bring in another healthcare practitioner to treat that person, either in conjunction or instead of us at that particular time. And so we're not using these assessments to make an evaluation, or we're not using them to make a diagnosis, because that's outside our scope of practice. And so the two I want to talk about are the anterior drawer and the talar tilt. And the anterior drawer is specifically for this anterior talofibular ligament. And so what we're looking for is either instability in the joint or pain. And so how we do this test is we have the person just seated on the edge of the table, and we take our, I'm going to refer to top hand and bottom hand. We take our bottom hand and we just cup the heel, and we bring them into a neutral position, or 90 degrees, okay? And we want to make sure that they're all relaxed, and how we do that is we just tell them to let your toes rest on my forearm, okay? If they're holding their toes up, their muscles are contracting, and that's not what we want. Okay, so we've got them in this 90-degree position. He's nice and relaxed. All I'm going to do is secure his tibia with the top hand, and then I'm going to pull his heel straight towards the ceiling. So I'm trying to get a shift of the foot in an anterior direction, okay? So they call this the anterior drawer, because I'm trying to slide his foot anteriorly. Now, what we're doing is we're placing stress on this anterior talofibular ligament, and so if it was injured or unstable, the foot would slide forward. He may or may not experience pain depending on when you're doing the test. All right, so the other test that we're going to talk about is the talar tilt. And the talar tilt is more specifically for calcaneofibular ligament. And so how we do that one is we want to, once again, put the foot in a neutral position or 90-degree position. And I'm going to cup the heel. And I'm going to use this front hand, we'll call it, to grab his foot. Okay, and we want to use this hand to both keep his foot in a 90-degree position, and then also I'm going to help turn his foot with it as well. But most of the force for the turn is this bottom hand. Okay, so I've got my hand around his heel and around his midfoot, and then all I'm going to do is tilt it in. Okay, and what we're looking for, and you can actually see the tissue tighten over that calcaneofibular ligament. And so if I had his foot down here and did it, I wouldn't necessarily be testing that specific ligament. So we want to make sure that he's at 90 degrees, and I tilt his heel and his foot, and we're looking for instability in this calcaneofibular ligament or pain. And so what a person will typically present with is they'll describe an inversion mechanism. They stepped off a curb, stepped in a hole, something like stepped on somebody's foot, and their ankle rolled in. And typically they'll also describe a popping or cracking sensation and some sharp pain. And so depending on the severity, you'll see things like a lot of swelling. You'll also see lack of function, lack of strength, lack of range of motion. And also, if it's bad enough, you'll actually also see pain up the lateral side of the leg. That has to do with the fact that the muscles on the lateral side of the leg try to contract to prevent that ankle from rolling in. And so they get an eccentric load on them, and they actually, you have a muscle strain as well. Sometimes you can actually have a fracture either at the malleolus or at the base of the fifth metatarsal from one of the muscles in the upper leg. And sometimes what you'll also see, if it's really bad, is you'll see some bruising actually on the medial side of the ankle, just under the medial malleolus. And that has to do when the ankle turns in during the injury, the tissue on the medial side of the ankle gets crushed and it bruises. And so massage therapy at any stage is extremely effective in treating ankle sprains. And so we want to utilize the same strategy that you may utilize for a muscle strain or for a contusion, and that's the first strategy is to minimize the area of injury. The second one is to facilitate the reabsorption of the material that's associated with swelling. And the last one is to improve the consistency of the muscle tissue or the tissue in general. And so in the acute phase, that's when you're going to be utilizing, you want to control that area of injury. And we can do that by just applying some ice to start with. And so typically we're told not to address an acute injury for the first 24, 48, 72 hours. But what that causes is that causes or allows the area of injury to actually grow in size. And so when you have an initial injury, swelling is a good thing. It brings all of the material to the area that the body uses to heal itself. But if it gets out of control, it can actually create a larger area of injury, and that's what we don't want to have happen. So we can utilize ice and compression initially until the swelling is under control. The sooner we can start getting that swelling out of the area, the faster the body's going to heal. But you want to make sure that you're not working too quickly too soon and actually causing more swelling while you're doing that. So make sure the swelling is actually under control before you actually start doing some soft tissue work. And so initially we use ice, and you want to leave the ice on. You can use an ice pack, ice bag for 20 minutes out of the hour and do that several times a day. And a great little tip that you can pass along to your clients is how to make their own reusable ice bag. This is obviously a commercial one, but you can take a Ziploc bag, gallon-sized Ziploc bag, and mix rubbing alcohol and water in a 2-to-1 ratio, so 2 parts water, 1 part alcohol. You may want to double bag it so in case it leaks, so it won't leak, and then put it in the freezer. And you can reuse it as many times as you want to. So once we've iced, we can utilize compression. And one little trick that you can do is you can make a little horseshoe out of some felt. And what that does is it really contours to that malleolus. Okay? And so we can actually place that right around the malleolus. If I would have you just hold that for a second. Right there. We want just a normal ace bandage, and we can make sure you start at the toes, because you want to make sure that we're getting that swelling moving in the right direction. So we go right at the toes, and we're just going to spiral up. Thank you. Okay. So you want to use a little bit of tension. You don't want to use too much because it may be uncomfortable for the client. And you want to go up a little bit above the ankle. Okay? Now, what you want to instruct your client on is if they experience a lot of discomfort, they can do one of two things. They can either take the wrap off, put it on with less tension, or they can actually remove the horseshoe from underneath the wrap. So this stage, you may be doing this for, 2 or 3, maybe up to 7 days, depending on the severity of the injury. So we're going to be using this ice and compression to really control that swelling and start to move it out of the area. So when we're treating lateral ankle sprains, we saw that during the acute phase we want to reduce the size of the injury, so we utilized ice, compression, and a wrap. And so as that injury moves to the next phase, we want to utilize the next strategy, which is facilitate reabsorption as quickly as possible. And so once again, depending on the severity of the injury, we want to make sure that we're not making the swelling worse. So once we start to do a little bit of soft tissue, we want to make sure that the swelling is staying under control. If it's not at any time, if the client gets sore or if the swelling continues, we can utilize ice to bring that under control. Another method of icing besides just an ice pack is to utilize a slush bucket. Now you want the water roughly 50 degrees, so if there's some ice floating, you don't want a brick of ice inside some water. You want you don't want it to be too cold, and you only need to do that for about 5 to 7 minutes at a time. Then we can do some soft tissue, put them back in the ice bucket, and repeat that process several times. Okay? So once we've started with the next phase, so we're trying to get the swelling out of the joint as quickly as possible. In the ankle, it tends to linger a lot more because we're on our feet all the time. Okay, so that's why utilizing that horseshoe compression is extremely important and effective. And so the other thing we want to make sure is they're not just treating the ankle. We're actually treating the calf and potentially up the thigh as well. Okay, so we warm up the calf because these muscles, remember we said that they can potentially have a muscle strain due to eccentric contraction. So we've warmed up our calf, and this next technique is commonly referred to as milking the ankle. And so we've iced it down, it's nice and cold, and then all we're going to do to help get that swelling out of the ankle joint is start to just milk the tissue down. We're going to use very light pressure initially. And so all we're doing is we're just getting that tissue fluid, the substances that occur from swelling, white blood cells, all of that stuff out of the joint. Okay? And this phase may last 7 days, 2 weeks. It's going to depend. Okay? We can also start to incorporate some movement, so I can have him slowly dorsey and plantar flex, so he's just going to do a little bit of ankle pumps as I'm doing the stroke. Okay, so he's helping me along with that tissue fluid movement. Okay. Now, relax for me, as the injury moves into the last phase of healing, we can incorporate a little bit more aggressive techniques. We can start to really get into the joint space and work some of that tissue fluid that sometimes if it lingers too long, it becomes thick. And so we need to kind of be a little bit more aggressive, get it to loosen up, and then move it out of the area. And so we can do that a couple different ways. We can perform the typical friction stroke around the joint, so we can just do some frictions within the joint itself, multi-directional, around the ligaments. It may be a little bit tender, so just be careful. Be aware of your client's tolerance level. And then we can take our thumbs and we can actually start tracing the malleolus. Okay, really get in there. Another place fluid likes to hide is behind the Achilles. Okay, sometimes with ankle sprains that aren't treated quickly enough, you'll end up getting an Achilles tendonitis type issue. So we want to really get in that space behind the Achilles and get that fluid out of there. So we can get in there, we'd be a little bit more aggressive, and then we can do some general strokes, a little bit more pressure. I can also have him do some of those ankle pumps again as I'm in the joint space itself. Okay, so he's doing some movement, I'm just working right inside that joint. And you can make a difference on an ankle sprain that's a month old. I mean, you don't have to see these people right away. Depending on what setting you work in, you may see them right away, you may not. Relax for me. But if someone has an old ankle sprain and there's fluid stuck in there, and it's become that thick fibrous tissue, get in there and be a little aggressive and get that fluid out. Okay? If they're sore, you can always utilize ice. But we always want to incorporate common sense into our treatments. I'd really like to thank OakWorks for putting these videos together. I'm very passionate about massage education, and I think these are great tools for therapists. I have some really interesting things on my website, and I'd love for you to check it out at www.jurchperformanceeducation.com. Thanks, and I hope to see you soon.